As we begin our study of the lower appendages, the legs, we're going to begin by looking at the pelvic girdle. These are the bones that are going to attach the legs to the vertebral column and give you support. Notice by looking at these two sets of bones, the one on the left is the male, the one on the right is the female. You notice here that these two sets of bones, males and females, no matter which one it is, the bones are much larger and more massive than the bones that make up the pectoral girdle, making up the arm for support for the arms. Now, from this picture, you can probably see the most easy way to distinguish male from female is in this area right here. That's the pubic arch. Notice that the pubic arch in the male is much smaller than the pubic arch of the female. Typically, the female's pubic arch is going to be around 105 to 110 degrees, and the male's pubic arch will be around 90 degrees. This is a view of one of the two hip bones. This is a viewing from the lateral surface. You can tell it's lateral because you have the socket here that the femur fits into. Now, the hip bone is actually made up of three fused bones. The one on the bottom here, this is the bone we sit on. This is called the ischium. This is the bone that when you're sitting on your chair, this is the part that's resting on the chair. The bone in the front, this is your pubic bone. And the large bone on the top, this is the ilium. As a matter of fact, this part up here is the iliac crest. This is what you'll put your hands on if you put your hands on your hips. Now, the other major feature here that you'll need to know for exams is this big bony projection down here. As I said before, this is the ischium. This rough and bony portion down here is the ischial tuberosity. Now, the two hip bones are held together in the front by a band of cartilage, fibrocartilage that fits right in here. This would join one side of the hip to the other bone. That little band of fibrocartilage is called the pubic symphysis. The part where the hip bones join to the vertebral column, they'll join at the sacrum. This portion right here will will form a joint with the sacrum. This part right here is the sacroiliac joint. Now, when these three bones are fused together, you get a bone which is commonly called the coxal bone. Now, the next step here is from this whole arrangement here. The leg bone is going to fit right into here. Now, notice how tightly or how far in the thigh bone or femur goes into the hip bone. This provides a lot of stability, so legs are, when they're fully extended, can stand for long periods of time without really getting tired because the ligaments and tendons that hold this all together are pulling it in really tight. As a matter of fact, there is a small depression. If you look on the femur, this little spot right here is where a ligament is going to go from there into here to help hold that femur into the hip joint. Now, the thigh bone or femur is one of the largest bones of your body. It's divided into three distinct regions: the top, middle, and end, or proximal and distal ends. Now, on the proximal end, the features that you'd want to use to help you identify this bone is, first of all, the head. Now, the head, remember, has this little end into it here, the depression, where the ligament pulls it into the pubic bones. It's also got the neck. Now, this neck is the part that is most commonly fractured when somebody says they break their hips. people who develop bone loss, osteoporosis, this neck right here will become weakened, and when people stand up, many times that breaks if they are suffering from severe osteoporosis. People commonly say they fell and broke their hip. Generally, it's going to be more that they broke their hip or this neck and they fell. Now, attached to the proximal end, you have these two big bumps. These are the trochanters. The greater trochanter, because it's larger, and the lesser trochanter, the smaller of the two. On the distal end of the femur, you have the two condyles. This one on the outside is the lateral condyle. This on the inside is the medial condyle. It's the two condyles that are going to contact the next bone. That's going to be the tibia. And they're going to together make up the knee joint. Notice that there's a groove that runs down the center. So it's only on these 2 points that the femur actually sits on top of the tibia. From this view, you can see how the femur on your right and the tibia on your left will fit together. Now notice that there's only those 2 points where the condyles contact the tibia. And between, on the tibia, you have a small raised area that fits nicely into the groove here. This is going to help keep the knee from sliding back and forth, lateral and medial. Now the lower leg is made up of 2 bones, the tibia and the fibula. This is a lower leg bone from your right leg. Now one way to easily remember the arrangement of the bones is that from the outside to the inside, or from lateral to medial, the bones go in alphabetical order. So this would be lateral, F before T, fibula, tibia. Now, as the bones are sitting here, several notable features that you would notice just from feeling the surface of your skin. At the end, this would be where your foot would contact. You have 2 big bumps. This bump right here is the medial malleus. If you feel the inside of your ankle, that bump that makes up the inside of your ankle is this bone part right here. The outside of your ankle, the big bump on the outside of your ankle, is the lateral malleus. So the medial malleus is actually part of the tibia. The lateral malleus is part of the fibula. Now another feature that you can easily palpate or feel from the outside of your skin is this very sharp margin that runs right around the front of the tibia. This is what we all commonly call the shin. Hence the whole bone is usually called the shin bone. You can easily palpate this one, but also if you look very closely at the proximal end, you're going to get this bump right here. That bump is called the tibial tuberosity. This is the point where the patellar ligament attaches right here. This is where the force is applied to lift your lower leg. So you do a leg extension, like stepping out to walk or to run, the patellar ligament pulls out of the bone right here. And many times that bump can be aggravated from lots of running and jumping. And we generally call that that condition, where you get a large painful spur there, Osgood-Schlatters disease. And for some people it can be very, very painful. Holding the tibia to the fibula are many ligaments. Now I'm not going to test you on all the ligaments that hold them together except for one. There is one you need to know. There is a membrane or a ligament that binds all along this middle surface here. This membrane is called the interosseous membrane, and it helps to bind these 2 bones together. This is the kneecap, or patella. The kneecap is a sesamoid bone, which means that it is a bone that forms in the middle of a ligament or a tendon. Now that would seem kind of impractical, but really it's pretty helpful. If a bone forms in the middle of the tendon, or a ligament like this one does, it's going to prevent wear and tear of that tendon against the bone. If you were to think about having a ligament running from the thigh bone to the shin bone or tibia, those ligaments are going to be rubbing across two bone surfaces. Even if the bone surfaces are covered with articular cartilage, it still can produce wear and tear. Bones develop inside of some of these, like the kneecap, and it prevents the wear and tear on that ligament. Finally, we come to the foot. The foot is made up of several groups of bones. The first group of bones that takes the weight of the body, coming straight down, this would be the contact point between the tibia and the first set of bones here, which are the tarsals. Now notice how closely these tarsals all link together. You'll have 4 here and 3 here, all working together, and notice how close those joints are together. The next set of bones that come out that make up the foot proper are the metatarsals. The prefix meta means beyond, so metatarsals means beyond the tarsals. Finally, your toes themselves. This is your big toe or great toe. These toes are made up of phalanges. Each of these little bones here is a single phalange. So your big toe only has 2, but all the other toes have 3 separate little bones that make up your toes. And that locking together produces a nice arch to your foot, which acts like a little shock absorber to take up the impact every time you take a step.